Good evening and welcome to tonight's Spinal Workshop. Again, I am Dr. Ryan Weaver. Tonight we're going to be discussing one of the most crucial epidemics that has flown under the radar in the past few years. Now, what I'm referring to is not COVID. What I'm referring to is what we call the prescribed epidemic. This is a major problem in our community, specifically the great state of Ohio and throughout our country. This is one that is not often understood, and I thank you for being here, as this obviously is an important factor to you, and most of the problems that you all have suffered from were given this option as treatment. But for those of you who have selected our office, I applaud you for that. But again, that's not enough. We have to involve our community, our friends, our family. What we're about to discuss and share has probably touched each one of you to some extent, a family member or friend. Tonight's workshop, we title it The Problem and the Solution. You've also seen it labeled as Prescribed Epidemic. Now, there's a ton of information to go over in this. I'm going to try to keep this a very informative, to the point, matter of fact spinal workshop, so that you will be out here promptly in time, and that's something that you can go back and rewatch for those of you who watch on Facebook or YouTube. My promise is the information that we're about to go over, not even some of your healthcare providers teach their patients, or worse yet, tell them that there's other options for pain and for care and for treatment rather than a drug. So, I ask that you pay close attention. I ask that you think of somebody who you may know, as I referenced, who was affected by this. And better yet, most of our patients who say, I wish I knew what your office or you or Dr. Helms have shared prior. You know, something that we cannot do is ever turn back time. But the one thing that we can do is turn around and help others, or share with others, hey, this is something I wish I knew earlier on, or younger years, or took more seriously, or maybe I didn't exactly know what chiropractic care can do, and I ask that you share this with one person tonight. And I ask that you bring back a note card to your next appointment with 3 to 5 people who you think could benefit from chiropractic care. So, the problem and the solution. Is there anybody who knows somebody who was affected from the opioid crisis? Now, I know, again, 2017 to 2020, this was a lot more prevalent. Maybe you knew a little bit more about it then. Obviously, 2020 took over and overshadowed this. So, what are some of the drugs that you've heard of? Well, the big one in opioids, how about Oxycontin? Painkillers. Fentanyl, more so we hear that nowadays. How about illegal ones, heroines, things of that nature? The CDC Injury Center looks at death and non-fatal overdoses into 4 categories. Natural opioids, such as morphine, oxycodone, hydrocodone. Methadone, synthetic opioids. Synthetic opioids is another classification, so that's tramadol, fentanyl. Heroin, which is an opioid synthesized from morphine. So, a lot of these terms you've probably heard of. Yes? One quote, and I love quotes, I love analogies. One quote from Ben Franklin, tell me and I will forget, teach me and I will remember, involve me and I will learn. Involving you in this process. You know, spinal workshops we do not to attract new patients, or we need new patients. We want to serve our community and serve our patients so that they are educated patients, educators in health who can deal more health to more people. Because just us here in the office can't do that alone. So, again, we talked of opioids and painkillers and chronic pain and things like that bring most of our patients in the office. Again, we're starting to see a big effect in our area where patients may know other things can be helped by chiropractic care. So how about diabetes? How about heart disease? How about cancer? How about these things that are so mainstream? That's what we look at healthcare of, are dealing with these. And how many people are affected by those? That's a lot of people, right? Some numbers for you. Diabetes, 30.3 million. Heart disease, 25.4 million. Cancer, 14.7 million. Do you know that chronic pain alone affects 116 million people? You total up diabetes, heart disease, and cancer, it doesn't even touch chronic pain. And this is why we have an opioid crisis. It's very prevalent in our area. 30% of Americans is 116 million. So, how does this whole thing start? Well, if you go back to the 1990s, you may have heard of the Sackler family. There were 3 medical doctors who patented OxyContin, which, by the way, is a sister drug to heroin. It's 2 times stronger than morphine. The addiction rate, 4 days. In 1995, Purdue Pharmaceutical, that's one of their companies, okay? OxyContin, the tagline, and this shifted the entire drug culture in advertising that maybe you see today. Maybe you see Pfizer. Maybe you see heartburn medication. Maybe you even see blood pressure medication. It's advertised, and everybody's so nice and polite on the advertisement, and everybody's happy. This all started a shift in the culture of prescribing drugs in '95. OxyContin, the tagline. I love taglines. Ours is live your best life. OxyContin, the drug to start with and stay with. If that does not sound shady to you, we should be raising some questions. So, from the year of 2002 to 2017, there was a 3.1-fold increase in deaths, natural overdose deaths, or deaths involving drugs, and that's from the NIH reference, in 15 years. So, many of you have heard this. This is probably one of the most popular and most redone spinal workshops. But in Ohio, in 2017, 10 Ohioans die of drug overdoses. 8 were prescribed for chronic pain. So 10 may have went to their primary physician for something such as low back pain, a musculoskeletal complaint, and they were given the option of a painkiller. As we said, 4 days for OxyContin, the addiction rate. 8 of those 10 were, hope I get the numbers right here. 8 of those 10 were prescribed opioids. This isn't okay. Look how many of you have benefited from being here. The greatest thing about chiropractic care is we don't do anything to put anything in your body or take anything away from it. It's the God-given ability for your body to heal itself. It's its innate ability. Okay? So we have a problem. We've discussed this. We have a problem right here in our city, in our county, in our state, that we need to start upping our game as doctors, as chiropractors, as all doctors. Doctor means educator. We need to take this and educate our community. There is another option. So states taking action. Ohio filed a lawsuit against 5 drug companies for aiding the opioid crisis. West Virginia, got to give props here, they made a law mandate that chiropractic care had to first fail before you were able to be given a opioid. New Hampshire, research on chiropractic care, utilization, and less opioids. Death rates for overdoses involving synthetic drugs in 21 states. 10 states doubled in 2015-2016. Sorry, I kind of ran on there. So, again, you're seeing some states starting to kick it into gear. But 10 states, 20% of our country doubled in deaths in a year. The CDC found in, let's look at this here, May 2020 to April 2021, 11 months, 100,000 overdose deaths. 100,000. An uneducated, uninformed, and not confident population is very vulnerable and easy to manipulate. So, again, I applaud you for being here. I hope you are starting to take these notes and take this seriously. This is not for me. This is not for just our office. You know, I hope that we have more and more chiropractors come to our office. I don't look at that as competition. My competition isn't other chiropractors or isn't chiropractic care. My competition is fighting overdose deaths that are not warranted, that can be prevented, that affect kids and families and loved ones and break apart families. One of the best known basketball colleges in the country did a very clever study. Ralph Kinney's research at Duke University in 2012. They found the leading cause of death in our country is poorly made choices. What the heck does that mean, Dr. Weaver? Well, poorly made choices. Basically, you knew that this was a bad idea and you did it anyway. So, what's that look like? Well, we know that smoking is probably a bad idea, but we do it anyway. We know that drinking alcohol, literally it's a poison, but we do it anyway. Being uninformed about sneaky prescribed drugs and not being informed is making a poor choice. You should be in charge of everything you put in your body, and you should be informed, and you should also take it upon yourself, because nobody's else is going to do it for you. So what are the things that you can do to improve your health? What are the things that you need to know and you need to take the initiative in today to make tomorrow a better day? Because health never stops. Every day you make a healthy decision or one of those poor decisions. One of my dreams is that Zanesville, Ohio becomes a health-based community, a health-conscious community. That only starts by sharing what you learn in this office, what you learn on our YouTube channel, what you learn on our Facebook channel as well. What we share with you is research. It is not biased. We don't get paid by anybody. We don't benefit ourselves from putting this content out. We look to our community to help serve others and serve others and serve our state and then our country. You know, I heard a speech from a Navy SEAL. He did a graduation speech at the University of Texas. In 5 generations, we could change the entire world. Every 25 years, if we continue to help improve the life of another, and another, and another. It has to start somewhere. Why not anywhere better than here? Being from here and growing up here, I know the area pretty well, and I have a pulse on this. It can be done, and we respond really well to somebody who is homegrown from the area. So my challenge to you, I said this earlier today, was think of 3 to 5 people that you could write on a note card, bring that back with you to your next appointment, and then we can discuss that. You can put their name, you can put their number, you can put, if that's okay, you can put, well, they're dealing with this, or they're dealing with this, or hey, you know what? Here's a pretty cool thought and story. What if they just wanted to have a better quality of life? Quote unquote, nothing is wrong. Because the great thing about what we do is nothing has to be wrong, because there are people who have cancer and have diseases and have no idea they have them because there's no symptoms. But at Apex Spinal Performance, we want to improve your quality of life. We want you to live your best life. And that all starts from being an educated individual. We've been around long enough now that we've seen patients for upwards of 4 to 5 years. And it has changed their life, it has changed their family. And we need more of that. We need less of overdose deaths that never had to happen to begin with. Okay? Again, one of the key parts that I left out, those 8 out of 10 individuals who were prescribed an opioid can become addicted very quickly, and a high rate and high percentage of those. A 30 milligram Percocet or Oxycontin costs about that much on the streets, about $30. Well, if you're used to taking 5 of those a day, that's $150 a day drug habit. Okay? That's about $1,000 and some odd dollars a week. It's a lot of money. Well, if they can't afford that, guess what's a third of the price? Something like heroin. I've spoken to local police who talk about how prevalent that is in our community. Now again, can you say that, some people were just drug addicts? Maybe. It's not my place to judge. But I know if they had the option of, well, what could chiropractic care do for me? Maybe that could have changed and saved a life and a family. So I'm asking you to join with me and our community and our team here at Apex to help change a few lives at a time. Again, this isn't about me. This isn't about Dr. Helms. This is about changing our community. So, I'm going to ask that you do a few things, especially those of you who are not here in the seats. If you've been on YouTube, if you've been on Facebook with us, do us a favor, subscribe to our channel so you get alerts when we put out fresh content. Share this with somebody. Share it. Make a post on it. Comment on it. Hey, this was some pretty life-changing knowledge that I gained tonight. Maybe you should take a look. Maybe share it with one of those 3 to 5 people. And again, for those of you who are here, when you get home, go on the lovely Facebook, because I'm sure our video pops up right at the beginning because they listen to that kind of thing somehow, right? And share that with maybe 3 to 5 of those people that you're thinking about putting on that note card. So, that's my call to action for you. Share this, write 3 to 5 people on one of those note cards, bring that back with you. Here's another idea. Maybe even bring them back with you to your next spinal workshop. Tell them you're going out to eat. Hey, I forgot I got to stop by this You can only tell them it takes maybe 10 minutes, even though we're a little past that. So they can see what we do here. That's one of the biggest things, is people don't understand what chiropractic care is and what it can do for them. And then sometimes it's not always the right time or place, but maybe one day it will be. So, I thank you all for being here. I thank you all for involving yourself in the community. And I thank you for taking the initiative to make your health a priority, and for having trust and confidence in our office to help you with your health journey. So thank you. We'll see you all at your next appointment. Have a good evening.